Good afternoon. Welcome to the NCREW webinar. We're going to wait about 1 minute just to allow some other people to join. Okay, we're going to go ahead and get started. Good afternoon. I want to welcome everybody to the Technical Assistance webinar for the Native Collective Research Effort to Enhance Wellness, addressing overdose, substance use, mental health, and pain, or what we refer to as the NCREW program. We are super excited to be here with you today to share information on this program and to learn what your questions are. And we want to thank all of you for taking time out of your busy day to be here and for your interest in this program. So I'm Kathy Etz. I'm the director of the Native American program at the National Institute on Drug Abuse, which is part of the National Institutes of Health. I am now going to ask members of the NIH NCREW team who will be presenting today to introduce themselves. Noting, however, that we have many other people who are working behind the scenes at NIH on this program, and we're grateful for the whole team that we have. But I want to ask for introductions, and I'm going to start with Jennifer Cho.
Good afternoon. I'm Jennifer Cho, Deputy Chief of the Grants Management Branch at the NIH National Center for Advancing Translational Sciences, and I'm serving as an Other Transactions Agreement Officer for the NCREW program. Nikia?
Good afternoon. I'm Nikia Brown. I'm Scientific Review Officer assigned to work with this group. I'm looking forward to working with everyone.
Hi, good day, everyone. My name is Jacqueline Smith. I'm a program official at NIDA. I'm going to introduce my colleague.
Hi, everyone. I'm Barbara Odekirk, also a program official at NIDA, working on NCREW. And I'll pass it to Angela.
Hi, everyone. I'm Angela Walden, program official at NIDA, and I'm also a citizen of Cherokee Nation, and I'm going to pass it to Carly Marshall.
Hi, everybody. My name is Carly. I'm a scientific program analyst for NCREW at NIDA, and I am a descendant of the Jamestown S'Klallam tribe.
Okay, thanks so much, everybody. I'm going to jump in if I can get the slides to advance. So we wanted to begin today with a land acknowledgement. We acknowledge that the NIH exists on the traditional land of the Piscataway and Anacostan people, past, present, and future. We honor the land itself and the Native people who belong to this land. We commit to our responsibility to take action through listening, learning, and responding to center Native American voices and communities in our work. And I'll note that this is a photo of what's now called Rock Creek Park, which is located in Washington, D.C. and Maryland. I want to begin with some housekeeping items, before we dive in. So please be aware that this webinar is being recorded. The recording of the webinar and associated materials are going to be published on the NCREW website. You do have an opportunity to submit questions today, and we ask that you do that through the Q&A link that's located on your screen. If you have any technical difficulties during this webinar, please write a message in the Q&A box and someone will assist you. Okay, and then I'm going to cover the agenda. So our session is 90 minutes in length. We're going to begin by presenting information about the NCREW program and the open research opportunity announcements associated with it. We'll cover a little bit of information about the use of Other Transactions Authority, which is the mechanism relied upon in these ROAs. I'll just note, when I started at the government, I didn't know what a mechanism was, but that's the way that we transfer money out of the NIH. And then we'll talk about how to submit applications and highlight some resources and key dates and describe the review. And again, finally, we'll address questions, beginning with some that we were grateful to receive in advance. And then we'll move to as many questions as we can answer live. I want to point out that we also have a Q&A document linked via the NCREW website, so you can look for answers to your questions there as well. That site will be regularly updated as new questions are posed. So as things come up for you, please do email us and we will work to answer questions. So let's begin with an overview of what we fondly refer to as the NCREW program. So first, I want to point out that NCREW is part of a broader initiative at the NIH called the Helping to End Addiction Long-Term, or HEAL initiative. HEAL bolsters research across the NIH to improve prevention and treatment for opioid misuse and addiction, and also to improve pain management, including understanding and treating pain. HEAL funding is allocated by Congress to address the opioid public health emergency. And it's for this reason that all HEAL funded programs must include a focus on addiction or pain. We emphasize wellness in the name of the NCREW program to emphasize strength-based approaches to addressing challenges such as the opioid crisis. I want to note that all funding for NCREW is provided by HEAL. And if you're interested, you can find more information about the broad HEAL initiative by following the link that is on this slide. Okay, so I want to start with a little background. Tribal consultations were held in 2018 and again through the HEAL office in 2022 with a goal to learn from tribal leaders and their appointed representatives what research and related activities they were prioritizing to address the opioid public health emergency. Many themes emerged in consultation, and some of those are listed here. First and foremost, we heard that tribal leaders place a high priority on addressing the overdose crisis, including opioid and amphetamine use and pain. There was an emphasis on supporting Native organizations to lead research, noting that this requires a significant investment in building research capacity and infrastructure. The idea of for us, by us was emphasized. We also learned that there's a significant need for more accurate and real-time data. Also, a need to specifically design and test interventions for and with Native populations, and for research and interventions to rely on Indigenous knowledge, including the incorporation of traditional healing practices and spirituality. I want to strongly note here that that's only where research is desired and approved, but also incorporating holistic conceptions of health and strength-based solutions. The definition of pain was discussed throughout the consultation, including the idea that drugs may be self-medication for pain. Pain encompasses both physical and psychological pain, and thinking about the impact of social determinants of health. That's the acronym that you see there. We love our acronyms in the government. So social determinants of health on pain and also on addiction outcomes. So I want to go over some driving principles of the NCREW program. So the NCREW program has been designed to directly respond to tribal consultation, also building from what staff at the NIH have learned from communities over the years. And it has the following driving principles. So an overarching principle is that NCREW seeks to support research that is community prioritized by tribes and Native American serving organizations. I want to pause here for a second and say that we are also going to refer to tribes and Native American serving organizations as TNASOs throughout this presentation. So NCREW is grounded in the understanding that research prioritized by Native communities is essential for enhancing culturally grounded, strength-based, effective, and sustainable intervention strategies, ultimately promoting health equity. This program recognizes that TNASOs are best positioned to identify and respond to community needs through culturally grounded knowledge, and that knowledge should serve as the foundation for research and data strategies. NCREW aims to build and sustain highly collaborative partnerships between the NIH, TNASOs, and ally organizations as these partnerships are established or augmented to respond to the opioid or drug public health emergency. The program recognizes that each of these entities has unique skills and knowledge, and by working together, we can leverage these skills and knowledge to achieve community prioritized goals. So what are the goals of the NCREW program? They directly map onto what we heard in tribal consultation. Simply put, the NCREW program supports tribes and Native American serving organizations to conduct locally prioritized research to address overdose, substance use, and pain, also including other community prioritized factors that are related, such as mental health and wellness. Specifically, NCREW has 3 broad goals. They are to support TNSAOs to lead community prioritized research projects, including research elevating and integrating Indigenous knowledge and culture, to enhance capacity within TNSAOs to conduct locally prioritized research. And we'll do this partially by supporting the development and provision of novel, accessible, culturally grounded technical assistance and training resources and tools. And the third goal is to improve access to and the quality of data on substance use, pain, and related health and well-being factors to maximize their potential for use in local decision-making. I want to note that these goals are purposely somewhat broad, and that is to facilitate supporting what communities prioritize within the parameters of the HEAL initiative. So NCREW relies on some key definitions, and I want to look at these first. So first, for the purposes of this program, tribes and Native American serving organizations are defined as federally or state recognized tribes or organizations with a core mission to serve and or a track record in serving Native Americans and that are poised to reach this population. Second, for this program, Native Americans are defined as American Indians, Alaska Natives, or Native Hawaiians. And finally, ally organizations are organizations with the ability to document a track record of partnering successfully and appropriately with Native American communities. So this slide is pretty complex, so let's break it down together. The slide includes the phases and the components of the NCREW program, and we're going to look carefully at the boxes in this table to break this down. So if you look across the top in the purple box, you'll see that the NIH intends to commit approximately $268 million over 7 years to support the NCREW program. Below that, in the red boxes, you can see that there are 2 phases planned for the NCREW program. I want to note that today we're focusing just on phase 1, which is approximately 2 years, and that for phase 1, NIH anticipates committing $25 million to funding the applications in response to the research opportunity announcements, or ROAs, that we're going to be focusing on today. If you go to the far left side, you can see that the components are broken down. So the components are the NCREW TNASO research and data projects. And you can see the associated ROA for that in the white box, ROA OTA 23007. The second component is the Native Research Resource Network, and the associated ROA is OTA 23008. And then finally, you'll see that there are other components that are listed there, and those have not yet been developed, and those will be determined as necessary as the program evolves. So again, in today's webinar, we're focusing on phase 1 and the active research opportunity announcements that you see there in those white boxes. We will not focus on phase 2 today, but I do want to note that it will build on phase 1 and is anticipated to be approximately 5 years. NIH intends to commit $240 million in phase 2. So there are some foundational components of NCREW that I want to talk about. The first of these is collaboration. TNSAOs and Native Research Resource Network members and the NIH will collaborate to meet the program objectives, leveraging the unique skills and knowledge each participant brings to the table. To support collaboration, we invite participation in cross-program meetings. Some of these meetings will be decided together once the projects kick off. But in year 1, we ask you to prepare to be involved in 4 teaming meetings or meetings that are focused on partnership development. I'll note that 2 of these are planned as in-person and 2 are planned as virtual. You'll see in the ROAs that recipients are also asked to budget for involvement in ongoing special interest or cross-site work group meetings. Those work groups have not been established. That's something that we will do as a program. But should think about that in the budget. Also asked to budget for a minimum of one NCREW governance meeting per month. And finally, I want to note that NCREW award recipients will also be invited to attend the annual HEAL investigators meeting. So potential outcomes. We see that there are many potential outcomes of the NCREW program, and I want to cover just some of these, reflecting what NIH's desired outcomes are that have been developed to reflect what we heard in consultation and from communities. So most importantly, we hope that NCREW will help to reduce overdose-related health inequities for Native people through science-based, culturally relevant, community-embraced, and sustainable strategies. Next, we hope to learn how to enhance HEAL-related research capacity and infrastructure within TNSAOs. I have heard tribal leaders and community members emphasize the importance of research being led by tribes and Native American serving organizations over the 24 years I have been at the NIH. While research capacity and infrastructure is certainly strong in some organizations, for organizations that desire to build more, we hope this program can help to support that. And we also hope to identify the best strategies or effective models for enhancing research capacity, including opportunities for Native scholars within these organizations, so that we can teach other organizations that want to do this what we learned for their future development. Next, we hope to consider data sharing and stewardship best practices for Native communities. We understand that there are many policies and community preferences that determine whether or when data can be shared. We would like to leverage the NCREW program and partnerships to learn together under what circumstances, if any, data sharing may be meaningful, beneficial, desired, and supported. As we work on that, if the NCREW program, relying on knowledge from all partners, identifies important opportunities for data sharing, we may work together in the future to build a Native data archive to support sharing and cross-site collection of outcome data. Our hope here is that we can build this together and ensure that any actions taken are in support of TNSAO's goals for their communities and for the benefit of Native people and communities. And I'll note one other potential outcome is advancing the application and integration of Indigenous knowledge in NIH research. Many of you are likely aware that the White House issued guidance to federal agencies in November of 2022 on recognizing and including Indigenous knowledge in federal research, policy, and decision-making. The memo noted that the guidance would help federal agencies integrate Indigenous knowledge into their work, specifically noting research. With the NCREW program, I feel like we have a tremendous opportunity to showcase the critical role of Indigenous knowledge in research and in community practices, reflecting what Native people have always known. So the NCREW program relies on other transaction authority. I talked about that as the mechanism that we're using to support this program. So use of other transactions enables the NIH to customize components of this program to meet unique program needs, which in this case includes applicant organizations submitting projects they prioritize. I'm going to highlight just some of this customization here as important context for the ROAs that you're about to hear about. And Jennifer, later in the presentation, will go into more detail about other transactions. So first, the application requirements for NCREW have been designed with consideration of reducing the burden to apply, while also supporting sharing with the NIH the work that you would like funds to support. Review for this program is also customized to meet program needs, and it relies upon what we call an objective review rather than the traditional NIH peer review process. This means that we have developed program-specific evaluation criteria and are employing a non-traditional rating scale. We are also relying on non-traditional reviewers, and more detail on the review will come later in the presentation from Nakia. Finally, I want to highlight that projects may be altered in real time in response to identified needs and in discussion with the NIH. So now I'm going to turn the presentation over to Jacqueline, who will share more information on what we fondly call the TNSAO ROA.
Thank you, Kathy. So today I'm excited to share information about Research Opportunity Announcement OTA 23007, research and data projects led by tribes and Native American serving organizations. So this ROA solicits applications from tribes and Native American serving organizations to develop, plan, or implement research studies, to improve data, such as access to data or the quality or availability of data, and enhance capacity to engage in research. As Kathy noted earlier, the parameters of what NIH is asking for under this ROA are intentionally broad to support the submission of what TNASOs and communities prioritize. Kathy also mentioned earlier that HEAL funding is a congressional appropriation. Thus, projects must explicitly include a focus on overdose, substance use, and that includes opioids or stimulants, or pain management. Projects do not need to include both pain and substance use factors, but must include one or the other. Projects may also include experiences or factors related to these outcomes. These may include wellness, mental health, alcohol use, or other factors that TNASOs understand are relevant to addressing opioid and substance use overdose. It is important to understand what will not be funded. Direct services or projects that solely intend to intervene in the absence of a research or research capacity component are not within the research mandate of NIH and will not be funded. Research capacity building that is not focused on HEAL-related research or data projects cannot be funded. And then similarly, research or data projects without a focus on topics or outcomes related to the HEAL initiative will not be funded. So applicants are encouraged to propose projects that generate knowledge to inform decisions and implement sustainable strategies to address overdose, substance use, and pain. Applicants are also encouraged to consider a range of Indigenous and/or Western methodologies and approaches. This includes those that rely on Indigenous knowledge or lived experience of Indigenous researchers or practitioners. Importantly, priority consideration funding for this ROA will be given to applicants who document a commitment to advance their research capacity to participate in future NIH research, and to meritorious applicants who have not previously applied for or received NIH funding. For today's webinar, I want to highlight two expectations for award recipients. First, recipients will be expected to determine ways to manage sensitive data and consider under what scenarios, if any, such information might be shared while prioritizing tribal policies, Native research approaches, and community preferences. And Kathy had talked a little bit about that in her slides. Recipients will also be asked to author a final reflections report to help facilitate knowledge, information sharing, and research capacity building for addiction and pain research in other Native American communities. Other formats will be considered with award recipients that best align with their community and communication preferences. And you can find additional details about expectations for award recipients in the ROA. So now I'd like to share some information on the application components. Applications will include at least 8 components, possibly 9, depending on whether letters of support are included with the application. So let's briefly walk through some of these components together. The first is the title page. Please include the application title and contact information for the applicant organization and all key staff listed. The second component is the abstract, which is a short summary of the application. The third component are the specific aims, which are limited to 3 pages and describes the broad overarching goals of the proposed project. It is a high-level discussion of the proposed work and its significance for the community and our Native American populations. It's a discussion about solutions that are novel or innovative and culturally appropriate. And then also a discussion about how proposed activities and/or methods can advance knowledge to address drug overdose, substance use, and pain management, and other related factors in the local community. The fourth application component is where applicants describe their planned activities, the approaches, and key personnel. Applicants should describe their research and/or data-related activities and the identified community needs. This includes a discussion about the potential advances to solutions to meet community needs, how the planned activities might yield sustainable benefits for TNASO research, and then strategies for building research capacity or data improvements and collaboration. Applicants also need to document the experience of key personnel who will be supporting the planning and implementation of proposed activities. The component also includes a management and staffing and partnering plan to describe how the applicant will ensure successful management of the proposed work. And then also include draft milestones, and this includes tasks associated with each milestone, expected start and completion dates for each, and then an estimated cost to complete each milestone. So overall, component 4 has a page limit of 12, so 12 pages total. However, staff resumes do not count toward it. There are other application components listed here at the bottom of the slide. Some of these components will be discussed later in the webinar, and all components are detailed in the ROA. So at this time, I'm going to switch gears and review eligibility. So this slide details the types of organizations that are eligible to apply. Kathy previously defined tribes and Native American serving organizations. As a reminder, it includes federally or state recognized tribes, as well as organizations with a core mission to serve and or track record in serving Native Americans, and that are poised to reach this population. Some examples of Native American serving organizations could be community organizations, criminal juvenile justice agencies, social service agencies, and others, some of which are noted here on the slide and also in the ROA. So TNASOs, who are nonprofits, for-profit organizations, governments, and non-federal tribal governments and their respective departments are eligible to apply to this ROA if located in the United States. Academic research centers, academic or private healthcare organizations, and research organizations are only eligible if they meet all of the following criteria. They are a tribe or organization with a core mission to serve Native Americans. They can document a track record of successfully meeting this mission. They are poised to reach this population. And we want to note that they can obtain a tribal resolution, an executive order, or a letter of commitment from the tribal authorized representative, if appropriate, before the award. In considering eligibility, please be sure to note the priority considerations I discussed earlier on a previous slide. Sometimes tribes or Native American serving organizations employ or contract with business or financial management companies to manage their finances. If these companies are the applicant organization, they will need to demonstrate a legally binding relationship with TNASOs in financial matters and be located in the United States. We want to note that business or financial management companies will also be required to obtain a tribal resolution or an executive order or a letter of commitment from the tribal authorized representative, if appropriate, at the time or before the award. Here are some additional considerations of eligibility to be aware of when considering this opportunity. They are outlined in the ROA, but I want to highlight 2 here. First, that TNASOs are eligible to apply to this ROA, OTA 23007, and its companion ROA, OTA 23008, which Barbara will review with you shortly. I also want to note here that foreign entities are not eligible to apply. Now I want to make a few key points about being responsive to this ROA. This ROA includes language regarding responsivity. It is important to consider responsivity because non-responsive applications will not be reviewed. I've already provided some information on the first 2 bullets, that direct services in the absence of research or a research capacity component are not responsive, and that all research topics must be related to HEAL. The third factor that could make a project or application non-responsive is an NASO that does not include a justification that clearly demonstrates a core mission to serve Native American populations and that they are poised to lead Native American community prioritized research work. If you have questions about responsivity, please reach out to us in advance of submitting an application. The email address is listed on the slide. And now Barbara will discuss the companion ROA, the Native Research Resource Network.
Thank you, Jacqueline. Hi, everyone. I am going to spend just about 10 minutes talking about ROA OTA 23008. And this ROA solicits applications from tribes and Native American serving organizations and/or ally organizations to participate in a multi-component and agile Native Research Resource Network during phase 1 of NCRU. This network will work responsively and collaboratively to develop and provide comprehensive real-time resources and support to TNASOs, identify effective strategies and approaches for supporting TNASOs as they develop and conduct HEAL-related research and/or data improvement projects, excuse me, and identify and implement activities to maximize investments and facilitate long-term sustainability of research and data gains made by TNASOs. For this phase, this Native Research Resource Network is structured to provide a broad range of research support that cannot be fully predicted in advance of receiving applications. It is also structured to be very agile and allow for flexibility in modifying activities, partners, or formal partnership structures. NIH anticipates 4 broad categories of support will be needed by this Native Research Resource Network. The first is technical support, training, tools, and other resources. Second is the development and continual refinement of a coordination and reporting structure. The third is support for meeting planning, technology, and related resources needed to establish, strengthen, and maintain partnerships. And the fourth category includes activities to distill lessons learned, spur innovation, and accelerate progress in enhancing research capacity with NCRU-funded TNASO sites, as well as other Native American communities. Applicants can apply to conduct activities in all of these categories, selected categories, or other categories that you deem important to addressing TNASO research and data needs, because NIH recognizes that TNASOs and ally organizations are best positioned to identify and anticipate innovative, effective supports that will be needed. NIH will prioritize applications with proposed activities that are likely to benefit greater numbers of tribes and Native American serving organizations. This slide provides examples of the potential activities in each of those 4 broad categories I just talked about. So examples of the types of technical assistance we anticipate include tracking and reporting on activities, identifying study designs, intervention research, financial accounting systems, and grant writing and monitoring assistance. Moving over to the next category on the slide here, NIH is seeking 2 or more organizations from the Native Research Resource Network to lead coordination and reporting across the NCRU program. Having more than just a single organization provide coordination allows some opportunity for tribes and Native American serving organizations to specify how and with which organizations they would like to collaborate for coordination. These coordinating entities might gather information and resources across sites, manage the coordination of comprehensive real-time technical assistance and resources, or support dissemination of information learned across sites. Under the partnership development category here, so moving on to that next category, example activities might include the development and implementation of innovative strategies for fostering and sustaining partnerships and providing support for teaming meetings, work groups, governance meetings, or other cross-site meetings. And under the last category here, examples of work that might spur innovation and accelerate progress include efforts to identify, consolidate, and disseminate best or promising practices for developing and enhancing research capacity within tribes and Native American serving organizations, possibly leading to the development of a research readiness model. Award recipients might report on the different structures and strategies that TNASOs employ to carry out research, or might develop an innovative program or process for training and mentoring research scholars. Again, these are all just examples, and there are additional examples in the ROA as well. So the next 2 slides, I'll share information on what to include in the application for ROA OTA 23008. There are 8 components of the application. The first is the title page, limited to 1 page. This includes the application title and contact information for the applicant organization and all key staff listed here. Second is the abstract, which is just a short 1-page or less summary of the application. Third is the specific aims, which are limited to 3 pages. And in this section is where you just provide a high-level summary of the scientific, training, operational, coordination, institutional, or any other strategies proposed to support TNASOs as they build research capacity and develop research projects. This is also where you will describe why the proposed work is likely to yield benefits for Native communities and how the proposed work is innovative and will advance strategies for partnering and providing research training and resources. The fourth component of the application is called Planned Activities, Approaches, and Key Personnel. This section is limited to 12 pages. And here you will describe the proposed activities and approaches for providing resources to and advancing TNASO research and data improvement projects, as well as enhancing research capacity. You'll document the experience of key personnel, supporting the planning and implementation of all the activities proposed. And again, as Jacqueline mentioned, you can submit 3-page resumes for the principal investigator and other key staff, but these resumes will not be included in the 12-page limit. In this section, you will also provide a management, staffing, and partnering plan. And lastly, you will provide draft milestones, tasks to be completed to meet those milestones, expected start and completion dates, and estimated costs. This slide lists the other components of an application, which are all detailed in the ROA, and most will be discussed by our next speaker. The tribes and Native American serving organizations and ally organizations funded under this ROA are expected to be diverse in their mission and entity type, but all must document significant experience working with tribes and Native American serving organizations. This slide lists the types of organizations that are eligible to apply for ROA 23008. Here are a few additional considerations related to eligibility for ROA OTA 23008. As Jacqueline mentioned, tribes and Native American serving organizations are eligible to apply to both 008 as well as 007, the ROA that Jacqueline just talked about. The restrictions on foreign and non-domestic organizations are the same for both ROAs. They're listed here. Note that foreign applicants are not eligible to apply. To be responsive to this ROA, applicants must be able to document strong Native American cultural expertise and experience working with Native populations. Applications that do not include this documentation will be considered non-responsive and will not be reviewed. Next, I'm going to pass the presentation to Jennifer to talk more about other transactions.
Thank you, Barbara. So I'm glad to briefly overview the Other Transactions Authority funding instrument, which will be utilized for these awards. The Other Transactions Authority funding instrument is different from traditional NIH funding mechanisms such as grants, cooperative agreements, and contracts. Other Transactions allows for significant flexibility via the addition or subtraction of expertise, tools, technologies, and partnerships to meet program needs. To that end, NIH may propose changes outside the scope of the opportunity and/or application. Other Transactions facilitates non-traditional partners and allows for funding that can be based on a number of factors, such as achievement of agreed upon milestones, the availability of funds, etc. So this slide highlights the differences between traditional NIH funding mechanisms and other transactions. Other transactions are legally binding instruments that may be used for a broad range of research and activities. Other transactions allows for more nimble and intensive collaboration between the NIH and award recipients. Despite its differences from more familiar NIH funding instruments, Other Transactions awards are nonetheless subject to federal law, most NIH policies, and congressional authorizing language. As you'll hear in more detail later, the application review process of Other Transactions also differs from grants, cooperative agreements, and contracts. So this slide demonstrates the key aspects of other transactions authorities specific to our ROAs. These points highlight how other transactions can be responsive to changing priorities in real time. Most importantly, other transactions will enable the NIH to reach non-traditional partners and empower TNASOs to have agency over their partners and needs. So we will now address the application submission process for these research opportunity announcements. The application submission system, an interface for submission tracking or ASSIST platform, must be utilized to submit all applications. ASSIST is a web-based platform used to prepare and submit applications electronically to the NIH. As a starting point, please visit the website referenced via the links on the slide. There are step-by-step tutorials and specific instructions to generate an NIH Other Transactions application. So to prepare to submit your full application, we're providing the following guidance. Before the time of submission, the principal investigator and their organization must be registered in ERA Commons. Please note that this can take up to 6 or more weeks to complete, so thank you for starting this process early. In addition to the PI, there must be someone designated as the recipient's signing official. It is desirable, though not required, that other key personnel and the whole applicant team are also registered in ERA Commons. Once registered in ERA Commons, the ASSIST platform can be accessed for the full application submission. To complete the application, users must have access to a browser, a PDF generator, and Adobe Reader software. For full applications, please carefully consult the detailed instructions in the corresponding ROAs. Should anyone have questions about the registration in ERA or application submission via ASSIST, please reach out to the ERA Commons Help Desk at 866-504-9552 and reference OTA 23-007 or OTA 23-008 in your request for assistance. So now we'd like to give you an overview of the timeline for the NCRU program, along with a few application reminders. As you can see, we're currently hosting webinar number 1 today, and we'll offer a second webinar on August 30th, focused on the registration and application submission process via the ERA platform in more detail. The optional letter of intent is due on September 1st. All ERA registrations should be completed by September 20th. Webinar number 3 to address Q&A will be offered in September. The full application is due via ASSIST on November 1st, 2023. Review will occur in January of 2024. Following negotiations with potential recipients, the first awards are expected to be issued with the earliest start date of June 1st, 2024. So this slide focuses on the optional letter of intent for the NCRU program due on September 1st, 2023. The letter of intent should be submitted to the following email address, ncru@nih.gov, and should include the information outlined on the slide in 2 or fewer pages. Please do note that letters of intent are not binding and will not be considered an objective review, although they are appreciated. So as Kathy discussed earlier, the NCRU program will consider data sharing. So NIH requires researchers to prospectively plan for how scientific data will be preserved and shared through submission of a data management and sharing plan, taking into account any potential restrictions or limitations, including those related to tribal policies or preferences. Please do carefully consult the links on the slide. Additionally, during phase 1, all recipients should also consider the NIH HEAL Initiative's HEAL data ecosystem and how they might engage with it. That link is also provided on the slide. Please do closely consult the ROAs for detailed application and budget submission information, and note that applicant organizations may not submit more than 1 application per ROA. However, organizations may participate as a partner on more than 1 application. So a few application budget reminders. In response to OTA 23007, as previously stated, please consult the ROA for detailed budget requirements. Each ROA has specific budget criteria that should be adhered to. The most important guidelines to note are that proposed budgets should be realistic, well justified, and for a period of up to 2 years. For this ROA, NIH anticipates total annual budgets will range from $200,000 to $550,000, depending on the proposed activities and resources. But there is no annual budget limit. Most importantly, the budget must reflect the needs of the proposed work. And finally, in response to OTA 23008, for a budget reminder, again, the most important guidelines to note are that the proposed budget should be realistic, well justified, and up to 2 years for phase 1. For this ROA, we anticipate annual total budgets will range from $500,000 to $1.3 million, depending on the proposed activities and resources. But again, there's no annual budget limit. And most importantly, the budget must reflect the needs of the proposed work. This following applies to both ROAs. Budgets should reflect requested line items for personnel, which is subject to NIH's salary cap, equipment, travel, detailed breakdown costs for subawards and consultants, other direct costs such as for data management sharing costs, and if applicable, indirect costs. If your organization has a negotiated indirect cost rate agreement, please apply this rate to the budget. If the applicant does not have an approved facilities and administrative costs rate agreement, you may propose a rate for NIH's review and consideration. So I'll now pass the presentation over to our scientific review officer, Nakia Brown.
Thank you, Jennifer. So the application review that will occur in January. So the NIH peer review process forms the cornerstone of the NIH extramural research mission and seeks to ensure that applications submitted to the NIH are evaluated by scientific experts in a manner free from inappropriate influences. Objective review. This is the process by which OTs or other transaction applicants are evaluated using criteria specified in the OT ROA. For OTA 23007 and OTA 23008, applications will be evaluated for scientific merit, contribution to the requirements of the NIH's helping to end addiction long-term, so the HEAL program, and capabilities of the investigators and key personnel. NIH will engage a panel with appropriate expertise to evaluate applications received in response to the ROAs. Both ROAs will undergo the same objective review process and will use the same qualitative evaluation categories across their criteria. These are high potential impact, medium potential impact, and low potential impact. So again, qualitative. Text in the next few slides are regarding the specific review criteria for these ROAs come directly from them, right? So we're just highlighting them here. Reviewers are instructed explicitly to use these criteria provided in the ROAs to evaluate the applications. An application does not need to be strong in all categories to be judged likely to have a major scientific impact, and thus deserves a high potential impact rating. As such, reviewers will be asked to identify 2 key aspects of applications that merit additional interest. These are the components and areas for improvement. So the review criteria for our ROA OTA 23007 are displayed in the next few slides. So the first criterion, evaluators again will be asked to assign a rating of highly likely, moderately likely, or unlikely to this criterion, which is likelihood of contributing to advances in addressing substance use. They're probing questions that help focus the evaluation. These probing questions focus on enhancing research capacity, contributions to innovation, and activities fostering the development and success of proposed strategies. Criterion 2. The likelihood of accomplishing proposed activities, with probing questions focused on milestones and the appropriateness of the personnel, partnerships, and staffing identified. Criterion 3, the likelihood of forming effective collaborations and partnerships. Probing questions are going to focus on applicants' demonstrated readiness to engage and collaborate, and mutual respect and trust of recipients in proposed activities. Reviewers will also be asked to provide an overall assessment of proposed activities and their impact, as high, medium, or low potential in advancing the following: research data or research capacity building to address overdose, substance use, and or pain management, and also possibly including related factors such as mental health and wellness. There is no formula to derive the overall impact rating from the individual criterion scores, and reviewers are instructed to weigh the different criteria as they see fit in deriving their overall impact rating. Reviewers will score an application as presented in its entirety and may not modify their scores on the assumption that a portion of the work proposed will be deleted or modified according to the reviewer's evaluations or comments. So the next ROA is OTA 23008. So the same review criteria pulled directly from the ROA are displayed here. Evaluators will again assign a qualitative rating of highly likely, moderately likely, or unlikely for each of the criterion. For the first criterion, it will focus on likelihood of meeting in-crew program needs with probing questions associated with proposed activities and planned approaches, efforts or strategies, clear commitment to research, and the appropriateness of proposed staff and partnerships. The second criterion focuses on likelihood of contributing research and or data expertise to support TNASOs to make advances in addressing substance use, including opioids and or stimulants and or pain disparities. Probing questions focus on sufficient evidence to contribute to the development of research or data subject matter expertise and resources and evidence of prior experience collaborating with Native American communities. The third criterion of focus is the likelihood of forming effective collaborations and partnerships, with probing questions focusing on the collaboration and development of partnerships, efficiency of prior experience or planned activities for collaboration, and promotion of mutual trust and respect for proposed activities. And finally, reviewers will provide an assessment of whether the overall proposed activities are likely to have a high, medium, or low potential impact on advancing TNASOs. The research that is led, data to address overdose, substance use, and or pain management, and also possibly including related factors such as mental health or wellness within Native American communities. I'd like to turn it over to Kathy now. Thank you.
Thanks so much, Nakia. Okay, so the wrap up. So sorry, I'm having a little technical difficulty here. Basically, just a very, very quick wrap up. The NCRU program, as we've emphasized, was created in response to tribal consultation. It is grounded in tribal sovereignty, and that's research prioritized by Native communities is essential for enhancing culturally grounded, strength-based, effective, and sustainable intervention strategies, ultimately promoting health equity. We started with that. We want to end with that because it's a core driving principle. We've also shared that OTA offers the NCRU program the unique opportunity to develop a custom program to support TNSAOs and allied organizations, it's the Native Research Resource Network, as they work to address, prevent, and treat addiction and pain in their communities. Using OTA allows for an agile and flexible approach, allowing TNSAOs to respond to new or evolving needs in real time. I want to note that the NCRU program has Trends NIH support. You can see that the issuing institutes and centers are the National Institute on Drug Abuse and the National Center for Advancing Translational Sciences. The presenters today come from those two institutes, but we've also had support across the NIH, and you can see the list of participating institute centers and offices. We've already noted that all of the funding comes from HEAL. So these institute centers and offices are not contributing funding, but rather contributing their technical expertise and their effort. And so we're grateful to have Trans NIH participation. We want to highlight some upcoming technical assistance. We've learned that for organizations that haven't registered in ERA Commons and Assist, that this can be a challenge. So we will have a webinar with more detailed instructions on how to do that. NIH staff will walk through exactly how to register. and we'll go through a hypothetical application submission in Assist. In that webinar, we'll highlight common error messages and how to address them and answer questions. And we've already noted that if you don't have an ERA Commons account, this is something that must be completed 6 weeks before application, but we would strongly encourage that you begin to work on that earlier in case there are challenges. We will also have upcoming webinars for office hours or question and answers. We strongly encourage you to email ncrew@nih.gov with any questions that you have. And the sign up information for those office hours or question and answer hours will be forthcoming. We want to point out that our questions and answers are updated weekly on the NCREW website. So please check back there frequently if you continue to have questions. And finally, this is the group that presented to you today. I just want to put a face with everybody's name. We really want you to apply to this program. We encourage you to contact us, and we are super grateful for your time today. Here again are resources in terms of the NCREW email address and then the website. And is that where you come in, Angela?
Yeah, thank you so much, Kathy. And thank you again, everyone, for being here with us today. We're going to use the rest of our scheduled time to respond to questions about the NCREW program and the ROAs. We received a number of questions in advance of the webinar, and we want to thank folks for submitting those. And then we also want to encourage folks to continue to add questions into the Q&A box in the Zoom. So like Kathy had mentioned previously, we're going to address as many questions as we can in our remaining time. And as mentioned before, the recording of this webinar, the supplemental materials, and an updated Q&A will be posted to our website soon, and we'll continue to update the Q&A regularly. So with that, I will begin with our first question, which I will direct to my colleague, Angela. So the question is, what kinds of research and data projects are anticipated to be funded under the NCREW program?
Thanks, Carly. So topically, the project must include a focus on overdose substance use, including opioids or stimulants or pain management. Projects may also include related factors such as well-being, mental health, or alcohol misuse, things like that, to support positive health outcomes in Native American communities. Within these topical areas, the specific research and data projects are expected to be diverse, since they are applicant driven and based on their community's priorities, but could broadly be classified into 3 areas. Projects to number 1, plan for or conduct research, 2, to improve data such as access, quality, availability, or 3, to enhance capacity of your community or organization to engage in NIH supported research. Projects may include, for example, planning and development of research, such as needs assessments, research or data project planning, expanding research capacity, pilot and feasibility assessments, and or conducting research. This includes technology needed to collect data or conduct research. It could also include research training and development for scholars working on the proposed research. All types of research and data collection will be considered. And applicants who are proposing a new way of implementing research will also be considered. The research may or may not involve human participants. Data availability and access are also critical for research. So therefore, projects that include a focus on data sovereignty and strategy development for improved data and knowledge sharing among TNASOs, or possibly with others, also align with the priorities of the NCREW program. Importantly, we want to mention what will not be funded. What will not be funded are direct services in the absence of a research or research capacity component. Capacity building that is not focused on HEAL-related research or data projects. And just as a side note, everyone can visit HEAL, that's HEAL.nih.gov for more information on what HEAL-related research and data projects might be. And finally, what will not be funded are projects that do not include a focus on topics or outcomes related to the HEAL initiative.
Perfect. Thank you, Angela. And that segues nicely into our next question, which is, can you provide more detail about what are considered HEAL-related factors?
So the INCREW program is part of HEAL of NIH's Helping to End Addiction Long-Term. That's the HEAL initiative. And that initiative is, the purpose of that is to speed scientific solutions to the national opioid public health crisis. So the NIH HEAL initiative bolsters research across NIH to improve 1, prevention and treatment for opioid misuse and addiction, and 2, pain management. So the HEAL initiative also emphasizes a whole person approach in which individuals and communities are understood as unique, as are risk, things like alcohol use, and resilience, such as connection to culture, those kinds of factors related to substance misuse and addiction, mental health, and pain. Further, risk and resilience are understood as intersecting with individual and community level factors and circumstances. So please keep in mind, folks, that applications must include a focus on overdose, substance use, including opioids or stimulants, or pain management, and may also include those related factors, things like mental health, wellness, alcohol use. And again, we encourage folks to visit the HEAL Initiative's website for more information about that.
Thank you so much. So the next question is, the research opportunity announcements, or ROAs, say that the NCREW program seeks to promote wellness among Native Americans by advancing research addressing overdose, substance use, pain, and related factors. How is wellness defined?
That's a great question. The NCREW program does not specify a definition of wellness. Tribes and Native American serving organizations, again, we call those for short TNASOs. Those that apply to conduct research or enhance data as part of the NCREW program can define wellness based on community priorities. Please note, though, that wellness cannot be the only outcome measured. So just quoting directly from the ROA states, projects must explicitly include a focus on overdose, substance use, including opioids or stimulants, or pain management. They may also include related factors such as mental health or wellness, among others, to support positive health outcomes in Native American communities.
Thank you. Another question for you. Can single research projects or one-off projects be funded under ROA OTA 23007? I also love all opportunities to say 007.
Yeah. Yes. However, applicants should note that enhancing research capacity is one of the 3 primary goals of the NCREW program, and therefore consider how a single project will work to enhance research capacity within the TNASO.
Great, thank you. Another question is, are ROA OTA 23007 applicants encouraged to have experience managing federal awards?
So applicants are not required to have experience managing federal awards. They are required to have the organizational capacity and fiscal experience and/or expertise available to manage a program greater than $200,000. So this expertise could be based on prior experience, partnerships or planned partnerships, or a proposed plan to successfully manage the federal award. The purpose of the NCREW program is to support TNASOs as they enhance their capacity to do research. Thus, it's not expected the applicants will have demonstrated expertise for this ROA, but all applicants should have a plan.
Great, thank you. Another question is, are academic institutions eligible to apply as the applicant organization under ROA OTA 23007 if they have partnerships with tribes?
So per the ROA, an academic institution is eligible if they can meet all the eligibility criteria listed in the ROA. So pay careful attention to that. Also note, the intent of the ROA is to build capacity within TNASOs. Therefore, NIH will prioritize meritorious applicants who have not previously applied for or received NIH funding.
Thank you. We have a question switching to the other ROA, which is, what are examples of ally organizations for ROA OTA 23008.
For ROA OTA 23008, ally organizations are defined as organizations that can document a track record of partnering successfully with Native American communities. To be eligible for OTA 23008, applicants must demonstrate significant experience working with TNASOs. Applicants do not need to be a federally or state recognized tribe or Native American serving organization. We can give some examples of ally organizations. Those might include, for example, a research technical assistance organization that's not affiliated with a federally or state recognized tribe or organization, but has experience contracting with tribes or researchers for the purpose of coordinating data collection, analysis, and reporting on projects focused on Native American populations or communities. Another just example of what that might look like, it could be a faith-based or a community-based organization that's not affiliated with a federally or state recognized tribe or organization that serves a significant number in terms of their total community or clients of Native Americans. It could be a university with deep experience working authentically with tribes and Native communities. So those are some examples of what an ally organization might be. But again, just to emphasize the eligibility here, folks will want to be very careful in their read of that ROA for eligibility requirements.
Thank you. And I have a more general question, which is, what are milestones?
A milestone is a finding or a set of findings that signal the achievement of a specific aim in your research plan or project that can be objectively measured. An example of a poorly defined milestone could be something like collaborate with partners, whereas a well-defined milestone would be attend 4 team meetings with other in-crew program recipients within the first 12 months of the project.
Thank you. The next question is the anticipated budget range based on direct or total costs?
The anticipated budget range is meant to be a gauge for the level of funding the NIH may provide for the applicable ROAs. So the final award will be based on pre-award negotiations, and the final dollar amount may be more or less than the range provided. Applicants should provide a reasonable budget request based on the activities described in the application.
Thank you. Thank you all for these excellent questions. The next one is, who should attend the teaming meetings and how many days do we need to budget for this annual meeting?
Applicants should budget for a principal investigator or what sometimes is just referred to as a PI, and at least one other team member, or as many are anticipated as needed to attend these team meetings. Applicants may choose different individuals and partners, but budgeting for at least 2 attendees for up to 3 days, that's like 2 nights, would be a reasonable estimate per year.
Perfect. The next question is, my organization will not have a unique entity identifier or UEI in time for submitting our full application. Can we still register our organization in ERA Commons?
Yes. To register your organization in ERA Commons, you will not need a UEI. However, a UEI must be obtained prior to receiving an NIH award.
Thank you. And to follow up on that, another one is, I registered as my organization's signing official on our ERA Commons registration and want to know what happens next.
So once the registration is submitted and approved by ERA, the signing official, also sometimes called an SO, will receive an email to verify before the registration can be completed and any account information sent out. So this person would want to check for that email. Registrants should follow the process for ERA Commons registration, and that's outlined on the website. It's a very long URL, but you can go to era.nih.gov. From there, if you, the rest of the URL proceeds is /register-accounts /register-in-era-commons.htm. But don't worry, that URL will be on the Q&A on the website, so you can find that, and this information, of course, about ERA in the slides. So registrants should follow the process for ERA Commons registration outlined there to help ensure successful Commons registration.
Thank you. Another question regarding the letter of intent, or LOI, that we mentioned in the presentation. So if we submit a letter of intent, will we receive feedback before the official submission?
NIH encourages applicants to submit a letter of intent to help NIH plan for timely review of applications and to better align technical assistance webinars with any needs that are identified. The letter of intent is not an application submission, but rather a notification of intent to apply. Prior to application submission, NIH can address questions about responsiveness to the ROAs, eligibility, and the process of applying. Importantly, NIH staff cannot comment on research ideas or concepts shared in the letter of intent and cannot directly answer questions related to specific content of an application.
Thank you. Our next question is, can you provide more information on how applicants can justify their identity as a Native American serving organization?
Sure. Some examples of a justification may be submitting a copy of the organization's mission statement, which should articulate the core mission to serve Native Americans. Could be information about your track record of partnering with Native American communities and individuals, and or through means the applicant deems appropriate of demonstrating their historical commitment to serving Native Americans.
Thank you. The next question is, if you are not designated as a tribe or Native American serving organization, but an ally organization, could you still apply based on your work and or knowledge within your marginalized communities, for example, Black or Brown communities?
So ROA OTA 23007 requires the applicant organizations have core missions to serve and or a track record in serving Native Americans and are poised to reach this population. OTA 23008 states TNASOs and ally organizations funded under that particular ROA are expected to be diverse in their mission and entity type, but all must document significant experience working with TNASOs.
Great, thank you, Angela. Next question. What do you consider an ally organization for ROA OTA 23008?
An ally organization would be any eligible organization listed in the eligibility section of the ROA OTA 23008 that can document significant experience working with TNASOs.
Thank you. And this is our last question for now. Thank you all so much for such wonderful questions. In response to ROA OTA 23008, can a partner be one tribe, or is it required to have multiple tribal partners?
There is no, excuse me, there is no limit on the number of tribal partners and or requirement for one or more than one tribal partner. Only one organization can serve as an applicant organization. And with that, it's been a pleasure being the face of the answer of these questions for you all. I want to thank the team for helping us ensure that we have responses for those.
Thank you so much, Angela. We're coming to the end of our session. If anybody has any last questions that they want to pop into the question and answer right now, we can try to get to that. But as those seem to be slowing down, we're going to prepare to wrap up. I'm speaking slowly in case anybody's typing. but I don't see that. So again, we really want to thank you all for taking time out of your busy schedules to be with us here today. I hope that we have conveyed to you that we are extremely excited about this program, and we are here to be responsive. I want to encourage you to email any questions to ncrew@nih.gov. And I just want to say that NIDA, NCATS, and HEAL and the NIH are all grateful for all of you being here with us. And we look forward to learning from and partnering with you all. We just want to really emphasize, please consider applying to this program. So with that, I don't see any other questions coming in. So with that, we will end our technical assistance webinar today. Thank you.